Hello, welcome back to the Abdominal Ultrasound Clinic. This is Dr. Munir Abbasi. Well, we have got a patient here who is complaining of vague abdominal pain with increased gut sounds. So on ultrasound, let's see. Here is the liver, which appears obviously normal in size and shape. This is right kidney. This is epigastric view. I'm just taking a bird's eye view, otherwise we'll go into details afterwards. Now, here in the right iliac fossa, I'm scanning the right iliac fossa, which is showing this kind of pattern. These guts are showing hypoechoic walls. They are slightly thickened with intraluminal contents, which are fluid and food contents. But the thing to be noted here is the gut wall thickening. This whole segment has been thick walled. You see from this is transverse section of the gut at the right ileocecal region. Is showing a typical pattern of gut wall thickening here. This is the transverse view. This is showing typical gut wall thickening. Now, regarding the reasons, there could be inflammatory causes, infective pathologies, neoplasms, CA guts. So infective, mostly they are tuberculous like Cox abdomen, and inflammatory maybe ulcerative colitis, Crohn's disease, etc. But that has to be the patient has to undergo many other investigations to come out and to make a definite diagnosis. But my special focus is to show you the pathology. So here is the gut pathology, which is showing smoothly walled hypoechoic guts in the right ileocecal region. Whole segment has been involved. Another thing here to know now, the associated findings, others are the rest of the guts are this is the segment of the gut which is moderately distended, showing to and fro of the motion of the gut contents, moderately distended guts all over the abdomen. You see here. Another thing here, we have to find out whether there is any fluid in the peritoneal cavity or not. So here in this case we have streaks of fluid in the lower abdomen around the guts. You see, there's a thin streak, quite thin streak around the guts. Okay. Now in the epigastric region we have to go for the para-aortic or epigastric lymph nodes. We'll take a view of the epigastric region. This is transverse section of the epigastric region showing pancreas. This is the splenic vein below the pancreas. This is aorta giving pulsation. This is IVC. This is gallbladder. And there is no definite evidence of any para-aortic or epigastric lymph nodes. However, it cannot still be excluded. So patient has to undergo many other investigations unless we come to the definite diagnosis. Now this is liver. We are sorting liver for any kind of mass here. You see this is the lobe of the liver. Liver is normal size, displaying no evidence of mass. This is portal vein again. You see here portal vein is also normal. This is left kidney. Here this is the left kidney. Above it this is spleen, which is also normal sized, showing no evidence of mass. Again I am taking you to the gut walls, which is very interesting topic here. So most of the sonologists, they get deceived when they find out any gut pathology. they just overlook it. So this is really important thing to note when patient comes to you with vague abdominal pain or any other sort of complaint. We have to be really careful while scanning the guts. So here is the case. Patient has to undergo investigations to come to the definite diagnosis for the gut walls, why they are thickened. Here it is. Thank you.